People often told me churches don't do healthcare, doctors do healthcare. As the new outreach pastor at West Salem Foursquare Church, I was personally responsible for everything we did outside the four walls of our church building. A good friend, Sam Skillern, called me up and invited me to lunch. And the vest-wearing gentleman gave me this book, The Church of Irresistible Influence by Robert Lewis. And this really helped lay a foundation for what it meant for our congregation to truly influence our community in such a way that people could live differently. We started looking in the West Salem area at what neighborhood we were going to invest in. And so we went down to, at the time it was called the Flats, now referred to the Edgewater District, and we actually decided to adopt about 4 city blocks right around Walker Middle School. We began just building relationship with the people living in those blocks, asking them what it is we could do for them, providing food for them, providing diapers, formula, clothing. We would even deliver sofas. The #1 request that began coming in as they began to trust us more and more was in the area of healthcare. And so I looked just within our own church, and a good friend of mine, Dr. Marion Reynolds, I approached her individually and said, Marion, what do you think about coming down to the Edgewater District and beginning to see some people? She thought it was a wonderful idea. Dr. Reynolds, as well as a couple of nurses from our congregation, just began holding clinics on the 1st and 3rd Saturdays. We were helping between 70 to 80 people per month between those 2 clinics. This whole time, we're continuing as a team to pray and really seek the Lord as far as what it looked like for us to move into a permanent facility. I went to a medical conference here in Salem and actually was one of the speakers about the Salem Free Medical Clinic and the impact it was having in Salem. And after the conference, I met an individual from Salem Alliance. Her name was Marie Howard.
Marie came into my office after attending that health fair and said, did you know there's a church in West Salem that's doing a medical clinic? We were putting together plans to build this building that's now called Broadway Commons. A key question that we were asking constantly was, how should we use it to bless the community? We had always been very active in our neighborhood, serving Grant School and backpack giveaways and mentoring and after-school programs and many other things. And so we did a survey and we asked their neighbors in Grant and Highland, what would you want in this building? Resoundingly, over 85% of the people said a free medical clinic. And so when Marie came in and told me about Todd, Gould, and West Salem Foursquare, I thought, wow, okay, well, we'll start there. We just got along famously as we talked about the values of our hearts and the values of our churches. We felt we are a fit. We are really a fit. So I met with Todd a second time and said, would you like a permanent location? His eyes lit up, and little did I know that they'd been praying about it for a long time. So we brought together an expansion team that included insurance people, attorneys, doctors, nurses, dentists from different churches. And we realized that an interim step for us was a rented location before the Broadway Commons building would be completed. And one of the people to whom we were referred was Larry Tokarski. He said, I've got some property I think I would like you to see. And ultimately, Larry was generous to cover the cost of that space in the Northgate Center on Portland Road. Todd put together this amazing team of volunteers who took what was an empty 3,700 square foot space and turned it into an actual clinic. We operated on the Portland Road site until the Broadway Commons building was completed. We presently have a volunteer base of almost 400 people who serve at Salem Free Medical Clinic, and that volunteer base represents 43 different churches and growing.
Trinity Covenant Church out south now hosts our satellite clinic in the south part of the community. We actually just signed a commitment with Trinity Lutheran Church in Dallas to have a satellite in Polk County. People often ask me, who comes to the clinic? Who are the patients you serve? Well over 65% of the patients who come are the working poor. Individuals who are very, very, very hardworking, and they make just too much money to qualify for the Oregon Health Plan, but have no other means to access health care.
And often you've told me that they have to choose, do I go to a doctor and pay money, or do I buy food for my family?
The services that we provide at the clinic are obviously acute care for patients who come in with basic infections or illness. We also provide a diabetic clinic, a mental health clinic, as well as an orthopedic clinic. And we've just begun our dental clinic. We provided an amazing service for each individual who would otherwise end up in the emergency room if they had nowhere else to turn.
It is just a thrill to see the camaraderie among the volunteers, to see their excitement, their enthusiasm, their joy.
When I think back to Walker Middle School, where we have come from, 2 Saturdays a month, we now are running 16 clinics per month. We're open 4 days per week. We have a permanent facility, satellite locations. It is truly amazing the journey we have been on.
And when I think back to when that expansion team would meet, and we dreamed of someday we'll have the central location, and then we'll have a satellite in the south, one in the north, one in the east, one in the west. The more providers we have, the more clinics we have, and the more people we offer hope and help. And so if you have a friend or a colleague that's a physician or a chiropractor or a nurse practitioner, we would love to have them serve with us.
Because we truly want to be the hands and feet of Jesus to the community.